Hello, and thank you for joining us for a presentation on alcohol use disorders, brought to you by Hashim Chaudhry, Emily Dobez, Deborah Mason, and Megan Skelton. Our objectives are to demonstrate what classifies an alcohol use disorder using the DSM-5 definition. What are the signs, symptoms, and characteristics of the disorder? The causes, biology versus environmental, interventions, and treatments, as well as social stigmas. Within the DSM-5, an alcohol use disorder is found under the category of substance use disorders, which is described as a problematic pattern of using alcohol or another substance that results in impairment of daily life or emotional stress. In order for one to be diagnosed with a disorder under this category, within a 12-month period they must display 2 out of 11 listed symptoms, which we will discuss throughout our presentation. The severity of an individual's disorder is classified by the number of symptoms they display. For example, if the disorder is mild, they will display 2 to 3, moderate 4 to 5, or severe 6 plus. The DSM-5 definition allows for the diagnosis to remain during the reality of potential fluctuation of severity of an individual's condition, which may vary over time. For example, they may be in remission but happen to have a relapse. In Canada, it is socially acceptable to drink. There is an entire industry surrounded by the consumption of alcohol, which is actually considered to be a depressant drug that slows down your brain function. According to the Centre for Addiction and Mental Health, or CAMH, Canadians spend approximately $12.4 billion a year on alcohol consumption. Most drink responsibly, however, 10% of Canadians will develop an alcohol dependency at some point in their lives. Going back to 2004, it was reported by the World Health Organization, or WHO, that Canadian males had a 5.43% prevalence of developing an alcohol use disorder, while Canadian females sat at 1.92% prevalence rate. More recently, WHO published the numbers indicating alcohol dependence prevalence for 2010, and it was recorded that men had a 10.2% chance and women had a 3.6% chance of developing a dependency. Also from 2010, WHO published statistics reporting 31.2% of men 14.7% of women in Canada will experience heavy episodic drinking, which entails consuming 60 grams or more of pure alcohol in one sitting within a 30-day period.
Okay, I'm just first going to go over habit versus addiction. So a habit is acquired behavior pattern regularly followed until it is involuntary. So for example, biting your nails. You may notice that you're biting your nails when the habit first begins, but over time it becomes involuntary. You don't even notice that you're doing it anymore. And then addiction is something that you become enslaved to. So for the purposes of this presentation, alcohol is something that someone becomes enslaved to. So they don't feel fulfilled until they have a drink. And then there are 2 main signs that a person's substance use is risky or already is a problem. So one being harmful consequences, and these range from something as small as being hungover to something a little bit more severe, a lot more severe, as being homeless. And these consequences build up over time. So when you start drinking, you're not all of a sudden going to be homeless, but over time, that's what could potentially happen. And then there's a loss of control. So someone may be aware that there's a problem, but they can't say no to a drink. So this is when they really need to find help and to really gain control of their lives and be able to say no to a drink. And alcoholism develops over time. It's not something that happens overnight. So there are 5 stages typically with alcoholism. So the first stage is occasional abuse and binge drinking. It's more common with young adults, and it involves experimenting with alcohol and also involves drinking large amounts of alcohol all at once. And then there is increased drinking, which is the second stage, and alcohol consumption becomes more frequent, and someone may find excuses to drink, something like because they're lonely or they're bored. And then the third stage is problem drinking, so they're starting to feel the impact of their drinking. It may be affecting relationships, decreasing social activities, so they're not going out and socializing with their peers or with their family members even. And then the fourth stage is alcohol dependence. So it is possible to be dependent but not addicted. Dependence attaches drinking to a regular routine, and this is also where your tolerance to alcohol increases. And then the fifth stage is addiction and alcoholism. There is now a physical and psychological need to drink.
Alcoholism. So the first stage is tolerance. So as somebody continues to drink on a regular basis, they will need to continue drinking more and more regularly in order to get to the level of inebriation that they desire. Hand in hand with tolerance is withdrawal. So as somebody's tolerance increases, they can't go as long without needing alcohol. So symptoms of withdrawal can happen within a few hours after somebody's last drink. And in order to uh, not suffer from the physical characteristics of withdrawal symptoms, they choose to drink, which is just a nasty cycle of continuing to drink to cope, and which can ultimately turn into alcoholism. So physical dependence ties into this as well because the body becomes adjusted to a certain amount of alcohol, again with a tolerance, and in order for the person to function and be mentally, not really mentally, but for the person to feel like they can function at a normal level, they will need alcohol because they don't want to suffer from the withdrawal symptoms like insomnia, sweatiness, nausea, things like that, that we will discuss further on. Lack of control is huge for alcohol abuse. You may want to go out one night and have a couple drinks and you end up having a lot more than what you wanted to, or you go out one night and you tell yourself you're not going to drink at all, and then you end up spending a lot of money and getting really, really drunk. And that just kind of shows that the person doesn't have much control over their habit, even though they want to. Even if they want to quit, they might try to tell themselves that, but they just can't bring themselves to actually do it. And in this stage, they would definitely need some professional help in order to deal with these issues. And once it starts to affect lifestyle, so you stop doing activities that you once liked doing, you're neglecting responsibilities, you are missing work, things like that, because you would rather drink instead, then that's when it also starts to become a very serious problem. So when does drinking become a problem? These are some points that we'll touch on that can be used for sort of self-assessment, or if you know somebody that you think may have a drinking problem, these are just some points to touch on. So if the person has feelings of guilt, or they feel guilty for neglecting their responsibilities, they feel guilty for the amount that they're drinking, or they feel ashamed of their behaviors due to drinking, this is usually when it becomes a problem because it's hindering on what they would consciously do if they were sober, as opposed to what they're doing when they are inebriated. It's very easy to hide a drinking problem. So if somebody like close friends and family are concerned about your drinking problems and are coming to you and asking you about it, and letting you know that they think that you have a problem, the drinker might try to blame them for exaggerating on their drinking problem, denying that they actually even have a drinking problem, saying that it's not as bad as they think it is, and then just choosing to drink alone and hide it from their friends and family so they don't have to feel ashamed of their habit. If you come home after work from drinking and you have a few drinks, but this happens every night, and you're using it to de-stress and to cope with daily life activities, that's when it's sort of blurs the line between um, doing it in moderation and being dependent on it. So, a lot of people use excuses like, oh, my boss is horrible, or I had a really tough day at work, or I hate my job, as excuses and justifications for drinking a few drinks every single night. This ties into regularly overindulging. So, if you're going out every weekend and you're having a very active party lifestyle and you're choosing to drink heavily, this might go into on a weekly basis. You might start missing school, you might start missing work, you might start not meeting deadlines, things like that. And that can definitely affect your overall life. Neglecting responsibilities, so having family Your marriage might be going downhill and you're ignoring it. You might have poor relationship with your kids. Again, missing work, missing school, letting down people that are relying on you, essentially. So once you start to do these things, because the drinking has just gotten so out of hand, well, then it's time to seek some professional help. So some of these listed are symptoms that might occur with heavy drinking. Not might, they most likely will occur with heavy drinking. So injuries is a huge one. These might be injuries sustained to the drinker because they're so inebriated, they are stumbling into things, falling over things, breaking things. But this can also be injuries to other people as the drinker may become aggressive and abusive when they are at a heavy level of inebriation. Feelings of anxiety, depression, irritability, aggression, assertiveness, uninhibited emptiness, mood changes, all of these are sort of emotional problems that can happen when with heavy drinking, especially depression. It's a big one for alcoholism because it goes hand in hand, and it can be a vicious cycle. You become depressed, so you drink to deal with the depression, and then it doesn't help, so and the depression doesn't go away, so you continue to drink more, and it's just a very nasty cycle. As we all know, alcohol inhibits thinking clearly. This is why drinking and driving is such a horrible thing, and hopefully getting less prevalent. But yeah, you have difficulty making clear decisions, and just can't think things through and consciously and as smartly as you would if you were conscious. Blackouts happen, as I'm sure many of you know. When you black out, you just don't remember what happened in that time frame. You could be passing out, causing injuries to yourself, or most likely causing injuries to yourself. Trouble with relationships, with family, with friends, with coworkers, even because once drinking, with the mood changes that may happen with drinking, you just become pulled back from society, maybe, and just those relationships just aren't as strong as they would have been without a substance abuse issue. Spending money on alcohol rather than food. This is a lack of control. You would prefer to get drunk instead of getting actual food. And we'll talk about this a little bit later on as well. Legal problems related to drinking, public intoxication, public indecency, drinking and driving, just getting in trouble with the law because long periods of intoxication. So again, this has to do with tolerance. So because if your tolerance is quite high, you're going to continue to try to get drunk, and as you continue to drink, you get more drunk, and blah blah blah. Hiding liquor and drinking alone, that ties into what we talked about a little bit earlier, about how it's so easy, how it is quite easy to hide drinking, especially if you are drinking alone, and you can just downplay how bad it actually is. Okay, so now we'll talk a bit more about physical characteristics, so things that happen to the body due to excessive drinking. So unfortunately for you gentlemen, erectile dysfunction is a symptom, and it can be short term, so it can last for the night that you are heavily drinking, or it can have long term effects as well from overconsumption. So how this happens is the liver is only able to break down one standard size drink per hour, so consuming more than that over time will cause the toxins produced from drinking to build up in your body and affect your organs, including those involved in sex. So try to keep it to 2 drinks a day to avoid these problems. And ladies, we can also be affected as well, and you might not need to drink as much as you think for alcohol to disrupt your menstrual cycle. So consuming alcohol may increase estrogen and testosterone levels, which can disrupt your hormone levels and cause irregularities in your cycle, or you can even miss one. The amount of alcohol to determine whether it will affect your cycle or not is undefined and will vary from woman to woman. So following the guideline from the National Institute of Alcohol Abuse for 1 drink a day will help to avoid a missed period. With heavy drinking, eating, especially eating healthy options, most often gets overlooked. Alcohol may hinder the feelings of hunger or hinder the ability to assess hunger, and therefore someone may neglect eating or replace it with drinking. Even when hunger does kick in, the drinker will most often choose an unhealthy option over a healthy option. You know, we've all been there and would prefer McDonald's over anything else. But this will result ultimately in vitamin deficiency, and if it continues over time, then malnutrition will also occur. With the lack of proper nutrition, the immune system will become weaker, making the drinker more prone to getting infections as well. Gastritis is a condition that can be caused by alcohol, where the toxins cause the stomach lining to become swollen and inflamed, and it can actually be quite uncomfortable. This condition can either be acute and last for a short time, or chronic and last over a longer period of time. With continued use of overdrinking, it may cause the stomach lining to actually bleed, resulting in stomach ulcers, which will not be fun to deal with at all. The consequences on your liver from overconsumption of alcohol on a regular basis are detrimental, as most of us should probably know that. Drinking is associated with liver cancer and liver disease. So the toxins produced can destroy liver cells, cause fatty tissue buildup, known as fatty liver disease. It can cause liver inflammation, also known as alcoholic hepatitis, or even scarring of liver tissue, which is cirrhosis. And of course, ultimately, you can get liver cancer. So because the toxins produced affect the body negatively, it puts the alcoholic more at risk for other cancers, like breast, throat, and oral cancer as well. And just discussing the effects on organs, it can affect your heart, it can affect your brain, and it can also lead to dementia, a loss of motor control, sensations of burning hands and feet, flushed face, numbness, tingling, weakness in your extremities. So, all of these things. And actually, suicide is 6 times more higher for somebody who is an alcoholic as opposed to the general population, which is quite alarming. And this will also tie into the depression as well. Although physical dependency on alcohol has many characteristics, there are slightly different symptoms for those suffering from withdrawal. So we can kind of relate some of these to a hangover, as I'm sure most of us have experienced, but withdrawal feels much more severe and has longer lasting effects. So these symptoms can begin hours after someone's last drink and can range from 2 to 7 days. So most of these are self-explanatory, but for delirium tremens, this is a dangerous syndrome causing frightening hallucinations, extreme confusion, fever, and a racing heart. And this can actually begin 5 or 6 days after drinking stops. So when somebody is trying to cure their alcoholism, and they might just be thinking, okay, these withdrawal symptoms are finally going to stop.
The cause for alcoholism is not completely understood, but there is evidence that both biological and environmental factors influence an individual's likelihood of developing an alcohol addiction. So the biological factors, there have been a lot of advances in molecular testing, and there is evidence that certain genes do predispose someone to developing alcoholism. There are certain genes that create a low response to alcohol, therefore the threshold for alcohol is much higher, causing them to drink more to feel the effects of the alcohol, which potentially over time could lead to an alcohol abuse problem. There's also evidence that enzymes aiding in the metabolism of alcohol affects the chances of alcoholism, because the enzymes are what help to metabolize alcohol, creating either a higher intake into the blood system or a lower intake into the blood system. But with advances in molecular testing, there will only become more evidence of, well, either more evidence or less evidence of alcoholism and how it's hereditary and how it's within the genes. And then environmental factors. There are many reasons that could potentially put someone at a higher risk for alcoholism. And some of these include stress, peer pressure, cultural acceptance. Drinking could possibly be a large part of culture, low self-esteem, and an alcoholic parent. There is evidence suggesting that alcoholism is hereditary, bringing it back to biological factors. So if you have an alcoholic parent or an alcoholic family member, the chances of an individual becoming an alcoholic themselves is much higher. And there is also evidence that if you have an alcoholic parent and your parents are separated, you're also at a higher risk of becoming an alcoholic as opposed to someone who has an alcoholic parent but their parents are not separated.
A form of treatment is cognitive behavioral therapy, or CBT. It is a form of psychosocial talk therapy in which destructive negative thought patterns of oneself and the world are confronted, allowing for modification of unwanted behaviors or mood disorders to occur. CBT is often used with alcohol use disorders because it allows the individual to learn how to identify and correct their own problematic behavior. It focuses on their thought process, emotions, and resulting behaviors. This is done through educating the individual on a range of skills to help them cope with as well as manage their disorder and the potentially associated comorbidity, such as anxiety and/or depression. One of the main goals of CBT is to assist the individual in developing coping strategies that will not only help them within the moment but also help them build skills for the potential of the future anticipated problems, such as recognizing early cravings and/or when to avoid situations for the individual to feel high risk, such as relapse and losing control. This treatment has proven to be effective in group and individual settings, as well as receiving a high retention post-active therapy. The following studies are evidence-based CBT research. The first study was developed in 2013 and focused on using CBT to create a combined depression and alcohol use disorder treatment group. Their focal point was on depression that was linked to the participants' alcohol use disorder. The findings indicate that by using this form of therapy in a group, it allowed the participants to form peer support, change their thinking patterns, and increase both their confidence and self-success levels. As a result, this form of treatment was proven to be effective. The participants also indicated the group treatment created a more positive mood, as well as better coping techniques and overall better quality of life. However, it was also indicated that some participants discovered to be easier to avoid self-awareness by not openly sharing their true feelings because of this group setting. Therefore, some participants, to achieve the best results, would also benefit from another form of treatment, such as one-on-one therapy and/or medications. The second study by David Hodges suggests introducing spiritually modified CBT to those individuals with alcohol use disorders because the treatment would benefit a more meaningful side to the participant. Its effectiveness will be based on the individual's own spirituality, causing the therapy to become not only more meaningful, but also an ethical matter because it's building off their own existing knowledge. The study would ultimately speed up recovery, increase compliance, decrease relapse, and reduce discrepancies. However, since the study is still within the early stages, there's no results for long-term effectiveness of spiritually modified CBT.
There are many different treatment options for alcoholism, which is essential as no one treatment fits all. So this is really important to remember because everybody is different, everybody's going through different things, has different medical issues, mental illness problems. So it's important to remember that if something works for one person, it may not work for you. And this doesn't mean give up if something's not working, it just means to keep trying harder, and that's one of the most important aspects of treatment. So usually with treatment, they try to deal with the withdrawal symptoms first, as this is what's going to happen right away as drinking stops. So medication can be used. And there are two approved medications in Canada. One is Antabuse and the other one is Temposil. And although there's a critical level of medication that needs to be present in the body, for the effects to work. So typically it's used before alcohol consumption, and it gives an allergic reaction sort of feeling. So the hope is that these adverse reactions will cause a person not to drink because they don't want to have those experiences. So for antabuse to work, it needs to be taken 4 to 7 days before drinking. But for Temposil, it's actually a lot faster, and it's usually within 12 to 24 hours. So how it works is when it's ingested before consumption, it inhibits the enzyme in the liver that breaks down the ethanol byproduct known as acetaldehyde. I probably said that wrong, so I apologize. So when alcohol is consumed, there's a buildup of the acetaldehyde in the bloodstream, causing effects similar to the allergic reaction. So another treatment option is individual counseling with a therapist. Alcoholism can sometimes occur to a tragic event in someone's life, and they may need professional help to deal with their loss, or they may be dealing with depression or another mental illness. This approach can help the person deal with stress and manage coping skills better in order to avoid a relapse and turning to alcohol as their coping mechanism. And with individual counseling, they're still able to hopefully go to work and do all the things that they're accustomed to in their daily life. Group counseling or support groups, like the well-known Alcoholics Anonymous, are also a way to target treatment to alcoholism and maintaining sobriety. Oftentimes, people want to be around people who understand what they're going through and can relate to them, and so they don't feel judged. Similarly, for those who aren't ready to be in a social setting, can call a drug and alcohol hotline and receive information and resources available to help them. Friends and family concerned if someone's drinking can also call a hotline to seek information and resources on ways to help. If someone can't quit, cope, or function in everyday life without the need for constant help or supervision, a rehabilitation facility may be the best choice. Having on-site staff to deal with mental and physical issues, group and individual counseling, and a place away from triggers for abuse, the rehabilitation facility will help on getting the person on a full road to recovery. So here we have some government interventions that are listed. These are definitely not all of them, just a few to touch on. So the Systems Approach Workbook and the National Treatment Indicators and the Rapid Reviews all sort of go hand in hand. So basically it works to outline what treatment is and isn't working. The National Treatment Indicators are only done annually, and it's data that's collected by the National Treatment Indicators Working Group from participating provinces and territories. The Systems Approach Workbooks helps to deal with substance abuse problems in Canada through improving collaboration, communication, and coordination between all sectors of the government which deal with harms associated with substance abuse. And then rapid reviews are just to help, again, to decide what treatments are working and what isn't working. The Canada's Low Risk Drinking Guideline is information in the form of a brochure that can be widely found across Canada, especially in buildings that are associated with health. So it's basically just outlines how much drinks you should have in a day to prevent overindulging. It discusses for pregnant women how detrimental drinking can be, and it actually also discusses underage drinking as well, and that it does happen and that we need to be aware of it and how to deal with it effectively. So they recommend that teenagers should only drink when an adult is around and they're being supervised, and only 1 to 2 drinks at a time, and no more often than 1 to twice a week, and even that is a fair amount. So they have training programs such as the well-known Smart Serve program. So for anybody who wants to be a server, they would have to go through the Smart Serve program in order to help stop over serving people when they go out based on how much they have eaten, what their height and weight is, and things like that. So for Smart Serve, And the Smart Serve program ultimately just helps to prevent over-serving because this will lead to drinking and driving. Speaking of drinking and driving, there are many awareness programs like the Mothers Against Drunk Driving, where I'm sure we've all seen the commercials for them. as well as ride programs from the police, especially during holiday season when people are more apt to go out and to party and drive home afterwards. So these programs help to raise awareness for the general population as well as to help prevent drinking and driving and overconsumption.
And alcohol consumption portion to them. Society really makes it seem like drinking alcohol is acceptable and it's not really a big deal, and that you need to be drinking to have fun, which really in reality isn't the truth. You don't need to be drinking to have fun. And I think in today's day and age, as soon as you turn 19, specifically in Canada, it's a time that you can sort of let loose and drink as much as you want and go crazy. And I think a lot of people go overboard. And in today's society, it's socially acceptable to drink and it's readily available. Alcohol, you just have to walk to the LCBO and you can get any type of alcohol. And there's not a whole bunch of questions asked as long as you're 19. So I think in today's society, alcohol consumption is very accepted.
Cam H states that around 6,700 Canadians die each year as a result of alcohol-related complications. WHO echoed this concern and reported that 3.3 million deaths occur worldwide yearly as a result of harmful alcohol consumption. This attributes to 5.9% of all deaths around the globe. Clearly, alcohol use disorders are not to be taken lightly. However, we are living in a society which allows those suffering from a disorder to be enabled and blend in, causing it more difficult for them to receive early intervention. Thank you again for listening to our presentation.